time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Folks, I keep telling you that our healthcare network is getting better and better and better. Now with Lehigh Valley on board, it's just fantastic. Lehigh Valley Health Network, their slogan, a passion for better medicine, and that's exactly what they have. My guest today, folks, Dr. Yaqoob Mohyuddin. He is a cardiologist, and he brings a lot of expertise to the greater Hazleton area, and we're going to talk about congestive heart failure. Hello, doctor. How are you?
Hi, Sam. Good. How are you?
I'm doing fine. Now, where are you from, doctor?
Originally, I'm from Pakistan, but I grew up in North Carolina. I went to medical school there, college and medical school. Then went to Virginia for residency and fellowship at the University of Connecticut. And this has been my first job, and I've been here since 2009.
You look like you're a kid. You look like you're about 21, 22 years old. But and you're doing a fabulous job. Dr. Chatlow speaks very highly of you. You know.
Well, thank you.
And I was talking to some of the doctors here and some of the PAs that they're excited about this merger between Lehigh Valley. What's your opinion of that?
Well, absolutely. This is great. It's great for the community. Great for us as healthcare in Hazleton. You know, we couldn't find a better partner to partner with for providing better care to our community. Lehigh Valley is one of the top in terms of reputation and the amount of the quality care that they provide to their patients. And I think this will be a significant asset for the community moving forward.
I agree with you. And we were doing great before. I mean, Jim Edwards and his entire group, the board of directors, everything did a fabulous job, and it's just get better. You hope you never need to do it, but however, we know we have it. Now, speaking of that, you're a cardiologist, correct?
Yes.
Okay, and the subject matter today is congestive heart failure, now which we'll call CHF, folks. Okay, getting into medical lingo here, CHF. Okay. What is congestive heart failure?
Congestive heart failure is a constellation of symptoms. What it is that the heart is not able to adequately or efficiently move blood forward to the body, and that results in backup of blood, leaking fluid in the lungs, legs, the belly, and that's called congestive heart failure. Weight gain due to increased fluid because of the lack of efficiency of the heart to adequately pump blood forward.
Okay, now, how does one get into congestive heart failure? What is it that they do in their life? Is it smoking? Is it not exercising? Is it the bad foods? Is it obesity? I mean, so we could, I don't know if there's such a thing as preventing it. Okay, then we'll talk about how many people, how prevalent it is. But what do we do now to help ourselves a little bit here?
Well, there are two types of heart failure. One is called systolic heart failure, and the other one is called diastolic heart failure. Systolic heart failure is when the heart muscle is weak, it's unable to adequately pump and squeeze blood forward. The other type is diastolic heart failure, and that happens when the heart becomes very stiff. You can imagine the heart is like a balloon. You blow air in, it expands, then it recoils. When it recoils, the blood goes out to the body. So in a stiff heart, it's tough for it to expand, and overall the squeeze is normal, but the expansion and relaxation of the heart makes it difficult for blood to come in and then adequately go out.
Go ahead.
In terms of who gets the systolic or diastolic, it used to be that back in the 70s, high blood pressure was probably one of the largest causes of congestive heart failure. Nowadays, it seems to be more so coronary artery disease or blockages of the heart that have led to heart attacks that makes the heart weak. A particular muscle, segment of the heart dies, heart becomes weak, and over time that leads to heart failure. Diastolic heart failure is more so because of high blood pressure. And it happens slightly more in women than in men because women tend to have smaller heart cavities, and with high blood pressure, the heart muscle does become stiff, relaxes less, unable to fill adequately, and then blood and fluid can back up. Blood is about 60 to 70% water. So when the heart's unable to pump blood out, water leaks out from the tissues in the lungs and fills up the lung parenchyma fills up with water.
Okay, so now, if you have high blood pressure now, people are on high blood pressure pills, they have to monitor that, make sure that their blood pressure is within a comfortable range, correct?
Absolutely. In order to prevent heart failure, the underlying things that we need to watch out for is diet, staying away from high salt diet. High salt diet does lead to increased blood pressure, because blood pressure is determined by two things: how stiff the vessels are and how much fluid or blood is in the body. So the blood is determined by significant portion of the blood is water. So the more salt we eat, the more water we retain, because wherever salt goes, water follows. So the increased pressure is determined by increased volume of blood, and as we age, the vessels become stiffer. There's not much we can do about that in particular. So one of the mainstays of treating high blood pressure has been diuretics, which make you pee out water by retaining less salt, and by medications that directly relax the walls of the arteries.
So primarily what you're saying is that avoid extra salt. There's enough salt in your food to begin with.
We are probably consuming anywhere 3 to 4 times the amount of salt that
Yes.
we need on a daily basis.
Yeah, and the foods. My wife always tells me, there's enough food in there. I mean, enough salt in there, being an RN, that you have enough. So, if you're watching, your diet, okay. Now, the average age that people ballpark for that have congestive heart failure, what are the average ages?
So the incidence of heart failure goes up with age. As people get older, there's an increased chance of having heart failure. So anyone over the age of 40 has a 20% lifetime incidence of having congestive heart failure. And as we get older, that goes significantly higher. The people in their 70s and 80s will have a much higher rate than people in their 40s.
No, okay, so what do we do, okay, people who are in their 60s, for example, all right, or in their early 70s, all right? First of all, they should be going for at least once a year getting a health checkup, correct?
Absolutely. The most important thing is prevention of the underlying causes of heart failure: high blood pressure, heart disease, diabetes, obesity, smoking, and if you see your physician once a year at least to have your blood pressure checked, because as we get older, the incidence of high blood pressure goes up. And that can lead to stroke. High cholesterol, smoking can lead to heart disease, which can lead to heart attack, which can lead to congestive heart failure by with a heart attack, heart muscle dies, and then the heart becomes weaker.
So first of all, getting a checkup is very important. I know I go once a year for a full checkup, and I'm the biggest baby in town, believe me when I tell you. And as far as smoking is concerned, I don't know how many times doctors and medical people, or now even CVS is not even they're not going to even sell tobacco anymore. Not that you're trying to tell people to do. I mean, back in the 50s, Yaqoob, I don't think you were around then, but they were actually advertising, So these people who are in their 70s right now, who are smokers, I feel sorry for them, because they were told, they had doctors smoking and, et cetera, and they got addicted. So it's difficult for them to come off the habit, but it's doing so much damage to them, it's sad. So if they're home and, they're not active, all right, what do we do? What do you suggest to those people in their 60s and their 70s? First of all, get a checkup. It's critical to get a checkup, all right? That'll be able to determine what they have as high blood pressure. So what advice do you have for them?
Well, if somebody in their 50s or 60s or 70s is smoking, they need to stop, because the benefits of stop smoking can be seen in terms of heart disease as early as 3 years after they stop smoking. In terms of activity, the more active they are, the better it is. The more active they are, the more blood flow is going to the muscles. Activity tends to raise the top number of the blood pressure, which is a normal response. It decreases the bottom number of the blood pressure, which is diastolic, because it relaxes the muscles, decreases resistance, and it's overall good for heart health. Not only heart health, but it's also, now it's been plenty of data that in order to preserve memory function, delay the onset of Alzheimer's, exercise is very important.
Okay, folks, I'm talking to Yaqoob Mohyuddin. Dr. Yaqoob Mohyuddin is a cardiologist in the Alliance Medical Group, and now with the Lehigh Valley Health Network. Their slogan, a passion for better medicine. We come back, how prevalent is it in our area? What are some of the causes? What we could do? That whole thing of prevention, folks, that's the most important thing. How do you prevent it? Stay with us. Welcome back to the Sam Lesante Show. Folks, my guest today is Dr. Yaqoob Mohyuddin, and he is with the Lehigh Valley Health Network, with the Alliance Medical Group. Remember, 24/7, you can watch all of our health shows on ssptv.com. My email is sam@ssptv.com, and we're learning a lot about how to stay healthy here. Yaqoob is a cardiologist. Now, we're talking about congestive heart failure. Once again, check up once a year, at least.
Absolutely. Check up once a year, see your doctor, and if you have any symptoms of shortness of breath, swelling in the legs, fatigue, those are some of the signs to watch out for and be evaluated for congestive heart failure.
What are the causes again of congestive heart failure?
So the number one cause is heart disease. Other causes can be significant alcohol use over long term, high blood pressure, diabetes, which can lead to heart disease and heart attack and ends up causing congestive heart failure. And then there are less prevalent causes such as a viral infection that can lead to congestive heart failure, global weakening of the heart muscle. And in other parts of the world, there are rare causes such as parasites that can affect the heart and cause weakness of the heart muscle. But in the developed world, the overwhelming cause of heart failure nowadays is prior heart disease, heart attacks.
Okay, so again, things lead up to heart attacks and heart disease, okay, such as excessive use of salt, obesity, diabetes, smoking, definitely, okay. So being a cardiologist, around here for 5 years working here, what would be your estimate? If you told me, Sam, if, let's say, of 100 people that came to see me who have a congestive heart disease, congestive heart failure, I'm sorry, if they would have done this, this, and this, and this, it wouldn't be 100, it'd be 80, it'd be 70, it'd be 60. What would be your percentage if they would have followed the right, preventative steps?
Well, again, the most important things that would lead up to heart failure will be the same. Making sure that you watch your weight. Increased weight leads to diabetes. That leads to heart disease. Watching high blood pressure, watching your salt intake. If you have low salt intake, that you're less likely to develop significant high blood pressure, and not smoking. So all these things lead to heart disease, which leads to congestive heart failure.
How important is your diet?
Diet is very important. So there have been studies done, large studies, that have shown that a Mediterranean diet, which is a diet rich in seafood, good fats, omega-3 fatty acids, such as olive oil, fish, salmon, nuts, walnuts, almonds. These are good fats. They decrease the incidence of a recurrent heart attack by almost 33%, which is, if you look at in terms of medications, if you combine all the medications, you'll probably get significant benefit in the same range.
Well, I'll tell you, it's worked with me, okay? I mean, I took off about maybe 15 pounds, and my blood pressure came down. Well, not that it was real high, but it came down. And I take omega-3s, the PRN omega-3s every day, okay? I've been taking them for years. And since I've seen the cholesterol come down from 240 down to 170, 180. I've seen these things happen, and also I've changed my diet. I'm talking about because I always like to experiment myself to see if you guys know what you're talking about. You understand me? But seriously, so I think it's very effective that you do follow, the procedures. But when you say exercise, okay, now we had Joe on the show and talked about some of the things you could do at home and move around. We're not necessarily, for some people who the wintertime, some of the seniors just don't get out. They stay active in home, right?
Right. Well, I do have patients that, especially in wintertime, they go to the mall. The mall opens up early in the morning. They can walk around. Staying active 30 minutes a day, 4 to 5 times a week is beneficial for heart health.
How prevalent is this in our area?
Overall, there are about 5 to 6 million people in the United States that are currently living with heart failure. So you can imagine 2% of the population Our population in Luzerne County in Northeast Pennsylvania tends to be a little older compared to the rest of the country. So it's slightly more prevalent here, just by the fact that we have a higher percentage of our population is over the age of 60.
Yes, yes. Now, how do you control or how do you control or treat this heart failure?
The mainstay of treatment for congestive heart failure is medications. Patients usually are on 3 to 4 medications. There are certain medications that help you live longer. There are certain medications that relieve your symptoms. Diuretics, water pills that make you get rid of salt and as a result get rid of excess fluid in the body, are called diuretics. So patients are usually on a diuretic or two daily, most commonly being Lasix or bumetanide. And then one of the other diuretics is called aldactone. That is also important. It helps people with heart failure live longer. That helps the body get rid of excess salt, keep potassium inside. The other medications are blood pressure medications, ACE inhibitors, or angiotensin receptor blockers. And what these medications do, they relax the blood vessels, so it's easier for the heart to pump out. So if your blood pressure is, let's say, 180, the heart's going to have a harder time overcoming that pressure to eject blood out, as opposed to if your blood pressure is 120 or 130. So these medications not only help with the blood pressure, they also help unload the heart by decreasing the blood pressure, making it more efficient for the heart to pump out, and also helping people live longer. The other class of medications are called beta blockers. And these medications slow down the heart rate. They prevent arrhythmias from happening, which can be fatal and deadly. Then other treatments, such as a defibrillator. Defibrillator is a small device that's placed under the chest wall muscle, and one or two leads go to the heart. It constantly monitors your heart. So if your heart function is less than 35%, normal heart function is around 60%. If it's less than 35% from a prior heart attack or a global weakness of the heart muscle, then those patients are more likely to suddenly die. And in order to prevent sudden death is why the defibrillator is implanted. And if the heart goes into a dangerous rhythm, it shocks patients out of it and aborting death.
With women who have a history of breast cancer, they tell these women, you get to your gynecologist or mammograms early. How does heredity play a factor in congestive heart failure? For example, let's say my grandfather had it or my father had it, or it runs in a family. Is there a higher increase for me to have it?
So there will be slightly higher increase, but again, that can be mitigated by the fact that if we control the development of heart disease, which is one of the largest causes that can prevent heart failure. So if someone, 1 in 4 patients have a heart attack they don't even know of. Then there are patients out there who have pain in their chest and there are symptoms of heart attack, they may delay care. If they delay care, they don't seek help, it's more likely that the artery, whichever artery is causing the heart attack, cannot be opened up. That muscle cannot be revitalized with adequate blood flow at the right time, and that muscle will die. So if people have chest pain, they need to seek help sooner rather than later and not just sit on it and say, oh, it's nothing.
Well, the most important thing is if you have any discomfort, go to a doctor. But first and foremost is go and get a physical without question. Okay?
Absolutely, everybody.
Folks, I'm talking to Dr. Yaqoob Mohyuddin from the Alliance Medical Group and the Lehigh Valley Health Network. We come back, we'll talk a little bit more about congestive heart failure, how you can prevent this. That's the most important thing, prevention, folks. Stay with us. Welcome back to the Sam Lesante Show, folks. My guest today is Dr. Yaqoob Mohyuddin, and he's with the Lehigh Valley Health Network, a passion for better medicine, and folks that they're doing a fabulous job. We're talking about congestive heart failure, and what are some of the, we talked about the causes, we talked about what you should be doing. So when we're looking at what would be the dietary restrictions for the CHF patients?
The most important restriction being salt. Usually I tell patients not to take more than 1,500 to 2,000 milligrams of salt a day, usually no more than a teaspoon. Staying away from canned foods, staying away from processed foods, staying away from stuff that's already cooked. And if they go to restaurants, ask for low salt, no added salt food, because you'd be surprised, one can of soup that you get from a grocery store can be enough for a whole daily supply of salt for these patients. In addition, there are some patients that we rarely do put on fluid restrictions so they don't drink excess water.
Were you talking to my wife? She's been saying that for years. Okay, she said you could be amazed how much salt is in, a can of soup or whatever. The people think it's healthy, but sometimes there's a lot in there. What excuse me. What is the role of exercise and activity in heart failure patients?
Exercise and activity for any heart failure is very important. The more we exercise, the more our body becomes conditioned to doing that amount. So staying active causes decrease in blood pressure, decreases in peripheral resistance, which is one of the major determinants of high blood pressure or blood pressure in general, and it conditions the heart. So let's say if you take a person who is 40 years old, does not exercise. When they're starting out, if they exercise a minute or two, their heart rate will be 100, 110, 115 beats per minute. Once they become conditioned, the heart rate will slow down. So you need decreased cardiac output in order to maintain the same amount of activity. That's because of conditioning. So I think it's actually one of the things that we really need to stress even more in patients that have heart disease or congestive heart failure to remain active. Currently, Medicare does not pay for cardiac rehab in patients that have heart failure. Hopefully it'll change with time.
They should, don't you think?
Well, hopefully it'll change, but heart failure is responsible for, it's the number one reason for admission in hospitals nationwide, and it's a big cost to the healthcare system. And I think, we're all, with the whole changes in healthcare, one of the things is to find out how we can do things efficiently, and especially in heart failure. Starting last year, hospitals are not getting repaid or getting paid for readmissions within 30 days. So, we have to do, and our hospital and the Lehigh Valley Health Network, they have done a good job. We're below national average in readmission rates, and that certainly helps our patients, keep them out of the hospital, keep them healthy, and the nation's economy as a whole.
What about the services? What services do you offer to congestive heart failure patients?
We offer a whole host of non-invasive services to patients in the community at the Health and Wellness Center at Hazleton. EKGs, exercise stress testing, T-wave alternance testing that's done for arrhythmias, nuclear stress testing, stress echocardiograms, cardiac rehab, and our offices are there for the half of the cardiologists in the Alliance Medical Group.
So there's always someone there that...
There's always someone there.
When you have congestive heart failure, this is not a death sentence.
If you differentiate between the systolic and the diastolic, if you have systolic heart failure, meaning heart muscle is significantly weak, and if the patient goes to the hospital, their chance of survival is about 2.3 years. If you have diastolic heart failure where the heart doesn't relax well, the prognosis is slightly better. Mm-hmm. So it is, if you have a weakness of the heart muscle, it is a significant change in life expectancy. However, this can be managed. And with the technology that we have, especially in Cedar Crest Hospital in Allentown, Lehigh Valley Hospital in Cedar Crest, they have started doing left ventricular assist device implants as of last year and a half. And these are in patients that are older who will not be candidates for transplant. They can get a mechanical pump that has helped with congestive heart failure.
It's amazing what the medicines available today. Well, Doc, thanks for coming on the show. I really learn a lot when the doctors come on the show. Wish you the best. Say hi to my friend, Dr. Chatlo. Folks, we're talking to Dr. Yaqoob Mohyuddin, and he's with the Alliance Medical Group. Stop smoking, folks. Stop smoking. Limit the salt. I have a friend of mine, we go out for lunch. That's all he does is this, and I want to take him to break his fingers, but can't because he's a good friend of mine. But the salt is no good. Everything, and most importantly, The Wellness Center is there for you, folks. Give them a call. Dr. Yacoob's number is 570-501-6580. If you have any questions or any concerns, give them a call. Stay healthy. We'll see you next time.